When you're in the womb, your circulatory system doesn't function exactly the way it does when you're outside of the womb. Right now, you and I are taking in oxygen and offloading CO2 at the alveolar capillary level. But when you're in the womb, that's not where you exchange gas. You exchange gas through the placenta. Because of that, your lungs stay depressurized because you're not breathing, and your pulmonary system stays relatively constricted, so there's not a lot of blood through there. But you do have this bypass vessel between your pulmonary artery and your aorta called the ductus arteriosus. And blood follows the path of least resistance while you're in the womb, and it goes through your ductus arteriosus. But these kids that have congenital heart defects can have some serious problems that disrupt the flow of blood. But for most of them, it doesn't make much of a difference in the womb because they have that little bypass vessel, so the messed up cardiac circulation doesn't really come into play. But once they're born and they take a breath and they start becoming oxygenated, suddenly that pulmonary vascular system opens up and blood starts going through its normal path through the body. And then it starts hitting dead ends, or it starts encountering a lot of resistance because of those congenital heart defects. And in that instance, those babies can get very, very sick. And so what we do in that situation is we hack them. We hack them to open up that ductus arteriosus, which closed once they started becoming oxygenated and blood flow started going past it through the pulmonary system. We hack that ductus arteriosus with a medication called prostaglandins, or PGEs. Those prostaglandins keep that ductus arteriosus open, so we have deoxygenated blood mixing with oxygenating blood, so we do get some corollary perfusion that goes on outside of cardiac circulation. And we can keep that going and keep them relatively well oxygenated, targeting a lower oxygen level, usually in the high 80s. Once the oxygen levels start climbing above that, it starts promoting the closure of the ductus arteriosus. So through that medication and through targeting specific oxygen levels, we can keep them relatively well circulated until we get them to the operating room.